afternoon, and it's good morning in New York. And this is an offline recording with a colleague of mine and someone who I had just met. And I was so excited to have some time with Dr. Bob Evans and share with some of you with this offline recording about the work he's been doing, the work he did, the privilege he had to work with Dr. John Sarno and be supervised by Dr. John Sarno and Dr. Arlene Feinblatt, who are names that I know very well, and some of you may not know. But
and Dr. Eric Sherman, too.
And Dr. Eric Sherman were, you know, when Dr. John Sarno first got into this, he started referring people to this ISTDP therapist named Dr. Arlene Feinblatt. And she's in the movie with Michael Galinsky. And I imagine Bob would have been in the movie, but he probably bowed out. But now I want you to all meet Dr. Robert Evans. And I thank Matthew Rosett because we knew about you. Your name had been around. And then Matthew Rosett reminded me, and I was like, I'm going to bug him and bother him until he comes on my broadcast. So thank you so much, Dr. Bob Evans.
Oh, you're welcome.
Privileged to be rubbing shoulders with you, even if across the galaxies, you in New York and me in the little shining star in the Middle East. So tell me, I like to give a timeline to people. You know, you were in college, you were a psychology major. Then what happened?
Well, if you really want timelines for me, I went to college in 1971. So I graduated in 75. I started working. My first job was Lakeside School, which was inner city kids would go there for therapy, and residential treatment center for inner city kids. I was there for a year. Then I went to mental health centers and worked there, and started going back for my master's and my PhD. 1984, I started my PhD. By 1986, I was ready to do my internship for my doctorate. And I knew then I did not want a traditional psychology internship. So I came across the Rusk Insitute. I had known about it because my grandfather had been there as a patient years earlier when he had a stroke.
Wow.
And I was lucky enough to get in. September of 86, I started, and I didn't know about Dr. Sarno. I didn't know about the pain program. I found out about it through the intern who was on that rotation the first semester. I was fortunate enough also to get on to the pain unit for the second rotation. And that's when I met and started working with Dr. Sarno, Dr. Arlene Feinblatt, Dr. Eric Sherman, etc. So that's a bit of the timeline. And then Dr. Sarno and I developed our own relationship, and for many, many years, he would refer people to me in Jersey, where I was.
At this point, had he written his first book? Had he been because we all know him like he was doing his job, and then he starts to see different things happening with his patients, starts to try to understand what's happening, because we know the movie All the Rage and we sort of see his life. But at what point when you met him, did he had written a book? He was just seeing, TMS patients. At what point did you come in?
He started writing, I think in the 1960s was his first book, Mind Over Back Pain.
Yeah.
And he said at some point, ignore my first book, it's no longer relevant.
Oh, wow.
And then came three more, Healing Back Pain, which was already written before I got to Rusk. And people could check on this, I might be wrong.
Yeah.
Then Mindbody Prescription.
Mm-hmm.
And The Divided Mind he hadn't written yet. So he had approached Arlene, Eric, and myself to co-write the psychotherapy chapter in the Divided Mind.
Wow.
So we all did our own little piece for that book. So that book,
Wow.
I don't know when it was written, but it was after I was at Rusk.
I didn't know that. I didn't know that you had written. I know that the Mind Over Back Pain or Healing Back Pain, which is in 30 languages. Yeah. I mean, it's all over the world. I mean, like he's like Elvis. He is affecting people like every day. People are like waking up. He's such a household name. I mean, honestly, even with his bad PR, people who don't like him, he is known. He's really,
Well,
it's from my
people
world.
who don't like him are threatened by, the paradigm shift.
Exactly. So go ahead. So you're working with him and he's teaching you, like you're an intern. So you're kind of following him.
Well, my main supervisor was Dr. Arlene Feinblatt. She and I would meet regularly, supervision-wise. He would join us a couple of times a week for supervision, and we would just go over cases and the dynamics that were operating in the sessions, and I was just a sponge learning
Wow.
all this
Wow.
stuff. So it was, I didn't know back then, this again is 1986. I was just being a psychology intern, doing my thing, loving it. I've talked before about, I was very interested in Eastern philosophy back in college. So you had the whole discussion about energy, and now here's Dr. Sarno talking about, in essence, energy getting stuck in the system and sort of coagulating into a physical TMS psychosomatic symptom. So that resonated with me in terms of Eastern philosophy and energy flow and all that stuff. So I was in my element.
I bet.
And then for me, I just finished up my doctorate and I went into private practice, and I've been doing that for years and years.
Wow.
Mostly 85–90% of the people I work with are people who have TMS kinds of issues.
Wow. Wow.
And I still use the term TMS because that's what I kind of grew up with Dr. Sarno and Dr. Feinblatt. I know lots of people are using different terms and mind-body syndrome, and to me, it doesn't matter what you call it.
Right. Right. So there was, so you met, so obviously Dr. Dave Schechter did an intern. He came in as a patient, and then he kind of tagged on and did some work with him at some point. Were you around when Dave Schechter was in the office?
No. I think a few of the people, Howard
Yeah.
Schubner, they all eventually connected with Dr. Sarno and trained with him. Some of them might have been patients. I don't know the details, but
yeah.
I don't remember them there when I was there. I was there just the 1 year, September 86 to August 87.
Right. Well, Dr. Schechter just wrote a book about his experience with, like he said, the lessons I've learned from Dr. Sarno. So
does he say what year he was there?
I know, but I'll send you the book. It's a recent book. And he said it on his show, and I've met him in person. He said, Dr. Sarno was not always the easiest person to talk to, not always the most expressive. So we don't need to talk about that. It's not important, but I find it fascinating to meet people who knew him, who would watch him and observe him. And so I'd love to hear more about your experience with him, and also your experience with some of the cases that maybe you saw, and how my listeners and the people that will see this can keep learning that this is everything, but this is nothing new age. This is very scientific, and that people can heal the body, brain, I'd love to hear it in your words. I know my words on why this is such an important, not why, I don't like the word why. I guess I want to hear from you. I want to hear from you how this lessons you learned from Dr. Sarno. What did you take away from Dr. Sarno? How do you encourage your patients? Because lots of people will hear this, and I shared with that before we went on the recording, that they can't get better. They feel stuck. They think they're different. They're not, their situation, their symptoms are different. How do we reach the people, Dr. Bob Evans? How do we reach the people that are not getting a book cure? What are we missing?
I might be different than other people you've talked to. I don't look to reach people. People have to come to things on their own, and maybe that will lead them to learning. I've certainly had my share of patients who've had back surgeries and all kinds of medical route, and others who come to people like me for psychology before they've done anything medically. I had an advantage for years in that Dr. Sarno, who was an MD physiatrist, made the diagnosis and then referred people to people like me to do the psychology piece, the psychotherapy piece. But still, there were many people who would come and still resistant and unsure, etc. I think one of the things among many that Dr. Sarno projected was this idea of, the way I say it to people, it's just TMS. What does that mean? It means relax, let go of any fear, what if, and all the stuff we do. And it's the letting go of the fear. And people will talk about it in newer language, threat response mode, fight or flight. And not that it's that simple, but it's the letting go. People come with their personalities, the goodist, the perfectionist. So in the therapy, they'll say, "Okay, doc, what else can I be doing? After the first session, what else should I be doing?" Mm-hmm. Mm-hmm. And I say to them, "Okay, you promise you're going to do what I tell you to do?" "Oh yeah, whatever. What else can I be doing?" "Okay, here's what I want you to be doing. I want you to let go of this need to be doing."
Okay, but I'm going to be devil's advocate. Okay, but doc, I'm in pain. My pain level's 9. How can I let go? I'm in pain.
Well, how successful is your strategy now of not letting go?
Good one.
You're here with me. Why not give it a shot?
But how can my body cause this physical pain if you're telling me it's coming from my unconscious mind? I understand the brain. I understand the fight and flight, but how can my body be producing this physical manifestation? It's so hard.
Yes, isn't that amazing that the body can do that? Yeah. See, I'm not going to get caught up in, because why are we discussing that? That's, Dr. Sarno would say, that's one of the purposes of the TMS, is to distract from getting to feel emotion that we want to get to. We want to start to uncover and help facilitate. In a given session, you'll see all kinds of unconscious manifestations of the dynamic of TMS operating. I talk about this in the Divided Mind. For example, an incongruity between content and facial expression at any given moment. Patient's talking about his father and how angry he was at him. And he's chuckling and smiling and not even aware of it. So right at the very moment there is repression of a difficult emotion that the person's not even in touch with.
Right.
And you want to you want to stop right there and point that out gently, lovingly. But hopefully the person starts to see it and starts to catch themselves and starts to develop, which is a big goal for therapy, what we call the observing ego.
I love it.
Part of us who can be here observing other parts of us and catching the emotion getting tapped in that moment and being able to be aware enough to be able to release it and feel what their upbringing taught them is not okay to feel, let alone express. And that starts to release all this tension that's being held in the body. And what I always say, what's the first word in TMS? Tension.
Right.
So you're starting to help the person be more aware of and release all this tension that we all carry around with us.
It's so profound because so you're saying if we can learn, and this is where the letting go comes, if we can learn to observe, and this is a little bit of ISTDP, which you probably learned from Arlene Feinblatt, and I learned a lot from my co-host Rose.
You're talking about like Davinlu's work?
Yeah.
Yeah. That's right.
Right. And in the movie with Michael Galinsky, he was crying, but started to laugh because he was crying. And she picked that up immediately, and that he said, do you know that you're laughing while you're in your sadness? And then you just talked about that paradox of emotions. And Dr. Hanscom, Dr. David Hanscom, who I mentioned to you offline about, the spine, he's lovely. I learn a lot with him. And he also, he and Sarno would have an amazing conversation now if they were together, because he's speaking about the awareness piece. He's speaking, that's what you need. That's what we is even more than accepting. You have to, the awareness is the freedom. And he mentions that he talks a lot about anger, and of course Dr. Sarno talks about rage. And he goes to the point of saying that behind your anger is your inability to be vulnerable. Like, he connects it, he goes deeper with that. And maybe you can chat about that for a few minutes, about because people are feeling, angry and the rage, because Dr. Sarno called all the rage, why rage? Like, why that emotion?
Yeah, one of the things that Dr. Sarno and I would talk about a lot over the years, and I hope I had some influence, I think I did, rage would be just one piece of it. It's any emotion. Think of emotion as energy. Emotion, energy in motion.
Emotion, I love that. Emotion.
Yeah, that's not mine. That's what's her name? It'll come to me. She was in What the Bleep Do We Know?
Oh,
with Joe Dispenza.
Joe Dispenza, right? Emotion.
But it's any emotion that we learn growing up is not okay to feel or express or to show, etc. I think part of what you're getting at is anger and rage. Sometimes we're very in touch with it and aware of it, but it's protecting us from much more vulnerable feelings like hurt,
right,
profound sadness, shame, guilt, etc., etc. So it's any emotion that gets trapped and stuck, that's not flowing freely, is going to, just think of it, it makes common sense. Physically, it's going to kind of coagulate and form into a symptom at some point. And that fits in nicely with Eastern philosophy in terms of energy flow and what the meridians are all about, et cetera, et cetera.
Exactly. And it just, look, I I folded into very easily into the quantum physics work, which I wish I had months and months and years back to keep studying that. So I study it now, but I'm kind of incorporating it into my work, the Joe Dispenza work, but more so. And nothing Joe is saying is new under the sun. I mean, it's just the way he's packaging it, about that thoughts can hurt you and thoughts can heal you. And so we're saying that the chemical reaction of your thoughts and emotions and feelings, or how the quantum world looks at it, is that you have your thoughts, which are an expression of your feelings, and then this becomes will put your brain into fight or flight or rest and digest, and then will affect your whole immune system. I'm really simplifying it, but how and then because of my work in the pain reprocessing therapy with, and what I love is it is being studied. We are studying somebody being angry and what's happening to their nervous system. We are studying when somebody smiles, what's changing in their, in their neurons. And we're talking about changing the brain and regulating your nervous system and literally healing pain and disease. So this is where Sarno was just so on to something, and he might not have talked a lot about the brain, and he did. But so what we're all learning now is neuroplasticity, and I'm sure he mentions that in his own words. But that's what he's saying. It's like, because now the doctors and the scientists are studying what Sarno said. They're putting it to the study, and would Sarno say, we don't need to study it, people are getting better? Like, what did he feel about science? I want to hear from you. What did he feel about that?
This one of the stories that I tell, not a story, but some of the doctors at NYU who would, speak negatively about him, basically because they were threatened, would be his patients in private.
And their wives.
Yeah. The book, Thomas Kuhn's book, The Structure of Scientific Revolutions, that really says it all right there in terms of the resistance to paradigm change. He talks about in terms of Copernicus and Galileo, and look at what happened to them when they came up with these new truths. And, I put Dr. Sarno in that group as well, in terms of a pioneer who started as a medical doctor talking about this stuff back in the 60s. And there, it was talked about before that too, but what a pioneer. He and Dr. Arlene Feinblatt were together.
Yeah. Wow. No, I think there was just a PPDA conference in the last 3 days, Thursday, Friday, Saturday in Colorado. The organization, Dr. David Clark and Dr. Howard Trubiner and Physio-Psychological Disorders Association. I think Arlene spoke, not mistaken. I think she might have spoken. I might have even asked her to be on my broadcast, and she said, not now, or check with me later. I don't know. I don't know if I could carry conversation. I think Rose could better, my prior co-host who passed away, because she was an ICDP therapist. But I don't think Arlene wasn't interested to talk. But ICDP is also, like, it's a little bit more complicated and many more different layers into the psyche and the defense system and the defenses. And I think Sarno and Davenloop came together because basically our emotions, our anger is a defense mechanism. We're repressing because and then we're back to ego. We're back to what you said, just a couple of words. And so I love the ability to make bridges between all of this, because everybody will take away what they resonate with. As somebody will resonate with, what Sarno says and Scribner, and Dr. David Clark, who's this smart, very brilliant, gastroenterologist. He's telling all of his patients, you have to be the butterfly on the wall of your childhood. And that's what he's saying. It's like he believes 100% that if you don't kind of embrace your trauma and take it with you and be the most compassionate, adult to your little child, you're not going to heal your IBS. It's just brilliant how the profession is taking the basis, the foundation of what Sarno said, and hoping to approach different people from their life. Because I talk to therapists about our agenda. We have to be very careful about our agenda and what's going to help different people. But what I love hearing is that the philosophy that all of us can relate to, and I remember Bob reading the book 15 years ago, and I remember Xeroxing, look at that word, Xeroxing, copying the page with the eye. Sarno had the picture of the eye, and then he had a picture of the unconscious mind and the conscious mind. And I kept reading it over, and I couldn't get it. I kept trying to get it because somehow I couldn't relate to it from that point of view, because he was also speaking he was very literate, Dr. Sarno. Sometimes he'd say, think psychological, jump in with 2 feet. That would be his answer, and then he'd get into this literate place, and I sometimes would get a little lost until I started to understand the big picture. But I think what I'm saying is that the basic foundation is that the mind and body are intimately connected. And I think people just, it just still sounds new age to a lot of people. Or they say, yeah, I know, but this is what I wanted to get at. And I made a note to even mention this. People are getting it intellectually. And I can talk and people can talk, but my job as a therapist, an educator, is to help people take home how they can apply it and implement it. So when Sarno would say, jump in with 2 feet, it'd be like, yeah, great, terrific. Think psychologically. Yeah, how am I going to, how do you help? And what did you learn from those days? How people had to go home and be in the lion's den when they were most triggered and apply this work.
Well, the first thought that comes to my mind is meeting the person where they are at. So I'll have experience, but I don't necessarily have a program, an agenda. And I will help the person develop what I call a comprehensive treatment plan. That'll include a session with me and I say to them, there's wisdom in the unconscious, and the creation of a TMS symptom is getting you on a path that might be very good for you. And you want to kind of honor that. And so it gets you on this path of looking at yourself and working on yourself and wanting to understand yourself better, and in the process develop self-compassion. So many people beat themselves up, and that is perpetuating the tension and the TMS, etc., etc. Now, I know a lot of people in the TMS world have these programs, and I think it's terrific. The more people that can present packages that will be helpful for different people, the better. Personally, I'm in the moment. So when the person comes to me and they present, I'm meeting them where they're at and trying to help them develop a program that the TMS might be a part of helping them tweak, if not change, the way they live their life. So once a week, they might have a session with me, but they might start doing meditation. They might start doing relaxation. They might start reading certain books. They might start watching. I recommend movies all the time that are very therapeutic. And for me, it's in the moment. I'll be engaged with the person and, oh, wow, have you seen The Shawshank Redemption? Did you see the movie The Kid with Bruce Willis? Wow, it really fits in with what we're talking. And they'll go and they'll watch the movie. They'll come back and things open up,
Right.
and loosen up.
Right.
With all, so to me, it's like part of what's exciting is you never know where this can lead and what can come up.
Yeah. So what else will you, so what else will there be any kind of black and white protocol or strategies that you just know, I mean, people need to connect their unconscious mind to their conscious mind, like journaling, meditation, exercise? Do you also recommend you got to go back out and walk with that sciatica pain and tell the brain it's okay? Is that kind of what you'll do also?
When that comes up, I'll suggest that, like Dr. Sarno would, it's TMS is not going to hurt you. So if you're having pain, sure, go walk, go play tennis, do whatever. If the pain is so bad that you just can't, then you can't. Then take a break, and that might talk to another part of you that's the perfectionist that needs to learn how to let go and relax and not feel like that means you're being lazy and you're a bad person, or all the other stuff that might be an old program running in your mind.
Yeah. I another thing that both Dr. Hanscom and, Joe Dispenza will mention this, that we can get addicted to our story. We can get addicted to our pain. We can get addicted to that, because it's a predictive coding, something from the past that keeps coming up. So we're repeating patterns. And I know the work that you've been doing for years, and the work that us coaches are doing are really helping people to recognize that. And Rose taught me this, the ISTDP part was that if we can recognize our patterns and accept them with love and compassion, like the butterfly on the wall, we can move past them.
If that's right, if you're doing that, you've already transcended the being stuck in the trauma vortex.
Yeah, wow.
So you're no longer in the narrative and living the story and why is this happening? You're now developing more and more of your sense of self here outside of the vortex, being able to look at it objectively and with self-compassion. That's a big piece of this too.
Yeah, it's such an important chemical reaction. Gratitude's a chemical reaction, and gratitude and compassion go hand in hand. Can't heal a body we hate. And if we feel our body's punishing us, then we're in conflict. And if we can understand that our body's protecting us, and this is why I love this neuroscience stuff. The lizard brain, our brain is acting like it should, but we're just giving it this like, go ahead and protect us, because that's what it's coming from, the unconscious, because of our fear. So I love understanding it from that point of view. And I think that's what Dr. Sarno was talking about with the I and the unconscious. I think that's what he was getting at. I didn't understand it from the unconscious mind. And I love, could you mention it again? It's not my language, but I love hearing what you said about the distraction. So wait, the body is distracting. This is what I think is not so much my language. The body's distracting you from your emotions with the pain.
Dr. Sarno very early on would talk about TMS as a distraction.
Yeah.
What's it distracting you from?
Yeah.
Noticing, experiencing emotions that we learned are not okay to feel, let alone express. So you see it all the time. People are talking about their symptoms, and the TMS is working perfectly because they're focused on the symptom
Yeah.
and never getting beyond it to what's underneath it, which is trapped, stuck energy. Again, I like to look at it as coagulating into some type of a symptom. But the wisdom is the body's creating the symptom in the first place so that the person could get on a path of learning and understanding and getting past the symptoms so that they can start to allow themselves to be with and feel whatever emotions are there that they learned are not okay to feel, are intolerable.
You have a beautiful way of expressing it and kind of putting it, in a simplified way where people can sort of hear it, and we're not, we're not talking at you, we're sharing with you, we're really engaging you. This is another thing about the Sarno work. They're asking people to be their own doctor, to be their own medicine, to heal themselves, to not be dependent on the medical community. And when you need it, you need it. You need a chemo, you need a shot of cortisone, go get it. And then go home and do the work.
Absolutely. Well, like I always say, God forbid I had my leg severed in the subway. I would want microsurgery. I wouldn't want mind body. I would use mind body to help facilitate the healing.
Yeah.
But yeah, there's a place for traditional modern medicine.
Yeah.
Absolutely.
Yeah.
But when you have such staggering numbers of chronic kinds of symptoms going on, at some point, don't we need to say, what we're doing ain't working? Let's try other things.
Yeah. Yeah. Medically unexplained symptoms also. And look, the body is made for wellness. The body is constantly striving. That's its mechanism. That's its generator. It's constantly striving to get better. It's not meant to be sick. And chronic pain is not normal, and so
I want to just give a little shout out sort of to Peter Levine, who I trained in his somatic experiencing from 2008 to 2010. And that was wonderful too. I call him the Sigmund Freud of this century. Brilliant stuff.
Humble man. Yeah.
He would notice animals in the wild would be traumatized when they were attacked, but if they were lucky enough to escape, they would shake it out. And what we've learned with the evolution of the frontal cortex is we override our natural ability to heal by freezing and not allowing the body to just do what it needs to do.
Yeah.
So he and Sarno were really talking about the same thing, just getting out of the way and letting the body do its thing energetically. Emotional release is a piece of that.
Yeah, no, I love it. And the somatic, the somatic, the mind and body, and how movement is such an important part of it, and breathing, the breath and all that. So,
I always use the phrase mind, body, spirit. And spirit to me is energy. So I like that, mind, body, spirit.
Yeah, no, it's beautiful.
And it is a spiritual thing for me. The whole process is getting us on a better path.
Extremely. And when people bring God into the picture, for them, that's the peace that helps them believe in themselves and that they're Body
And
is,
whatever people are comfortable with. For some, it
yeah,
could be God. For some, it
yeah,
could be the universe, spirit,
yeah,
whatever works
yeah,
for each person.
yeah. Wow. You know, us coaches, we could talk about this all night long. We're just, we love it. It's so beautiful. So you're still in practice. Yeah.
I refer to myself now as semi-retired, which I love. I
Okay.
work I work all day Monday and all day Wednesday from home on
Okay.
FaceTime and Zoom. Tuesdays I'm in my office seeing people in person, and that's it. I don't work
Yeah.
Thursdays or Fridays anymore
Yeah. Yeah.
in
Well,
this role.
I imagine a lot of people come to you and you refer them out. You refer them to other TMS therapists in New York.
I'm I'm always very big on when someone calls me and for whatever reason it's not going to work for me with them, I really make an effort to try to get them to a good person for them.
Yeah.
Um, I'm invested. If it doesn't work, let me know. Get back to
Yeah.
me, and we'll
Yeah.
find someone else. I really
Yeah.
want to help
Yeah.
facilitate them finding a good person that they feel good about working with.
Um, how do you feel about journaling?
Like anything else, uh, whatever works, and different things work for different people at different points in time. I recommend Nicole Sachs' book, The Meaning of Truth, all the time. Um, Again, different things are going to work for different
Yeah.
people.
Yeah. It's so true. It's such an individual process. It's so individual.
Well, that's why I like helping the person develop what I refer to as this comprehensive treatment plan, which becomes a lifestyle, hopefully.
Yeah. Yeah.
That will include making shifts in the way that you're living your life on a daily basis.
Amazing.
And most people with TMS have the personality, the perfectionist, the overachiever. So they truly believe that they can't make certain changes. They have to and keep going. And part of the work is to eventually help them to see that that drive is a part of what's fueling the TMS.
Right. Right.
But it's very scary to let go because they're letting go of control, a feeling of control of things that help them survive
Mhm.
traumatic childhood.
But do you agree that people don't have to change their personality? They have to, you know,
People would say that to
they,
me all the time because Dr. Sarno would say to them, "You don't have to change your personality," and I would say, if certain elements of your personality that were not working for you are changed, is that a bad thing? I think the issue there is people have this fear that they're going to lose a sense of who they
yeah,
are.
yeah,
You're not going to lose who you are. You're going to just think of it as you'll delete a couple of things that aren't working so well for you, and you'll add, like the
or
Scarecrow in The
evolve,
Wizard of Oz.
right, or
Stuff here.
evolve into the person. Like some of the quantum work is like, we're this way, we want to be this way. Well, go ahead and go ahead and cross that bridge. That's the conflict. Cross that bridge. If you want to be a certain way, you can attract that. So if you want to
Right,
be
but you're not going to lose this
right,
sense of your identity of who you are. You'll
right,
just delete stuff that doesn't feel good.
right,
Why
right,
not delete it? And you'll
right.
add stuff that feels better and better.
Beautiful.
So
I like your formula. That's I like it. I like it a lot. And I like the simplicity. I mean, you're brilliant, man. You've studied for so long. You've been in practice for many years. You're aging gracefully, and you just put it right out there, just right out there in basic words that people can relate to. And I really like that because it's scary enough. And I think what's important is to come out of our head, come out of the intellect and into our body. And we need these basic kind of
that's
universal laws of like, let go, Not
That's
like
right.
calm down, but let go, trust.
That's
You know,
how I start the piece I wrote in The Divided Mind. I quote Fritz Perls, although I think I messed up and I attributed the quote to Victor Hugo in the book
uh-oh.
instead of Fritz Perls, but they both might have said the same thing. Lose your mind and come to your senses.
I love it.
Now, that's an interesting quote
I'm going to
because,
title that this, Lose Your Mind,
and come to your senses, right?
Come
Let
to Your
go. But
Senses.
what's so interesting about that quote is in our culture, lose your mind is has negative connotations. It's a
Yeah.
frightening thing. What do you mean lose my mind? I can't lose my mind. That means you're going crazy.
Yeah.
But it doesn't. It means you're letting go of the override, as Peter Levine would talk about, and just being more relaxed in your body.
Yeah.
So
No,
that it can do whatever healing it needs to do.
exactly. I kind of made this up, but I'm sure it's all repetitive somewhere. But I say, if you isn't letting go the ultimate form of control? Isn't letting go really a kind of a control? A letting go is, maybe this is the matrix. Letting go is like this sense of I'm in control by letting go. Does that make sense?
Yeah, I think you're making a good point that the letting go is something that has something to do with the feeling of control. If you truly have let go, there's nothing to let go of.
Yeah. Oh, I
Yeah,
love it.
yeah.
I love it. Yeah, we're getting very esoteric. So listen, I'm going to wrap it up. But look, I would love to like go once a week and talk with you. You could be my co-host. Think about it. I know you're busy. And at some point, yeah, you have a life. But I love really that I heard about you from also another coach, and then Matthew, and I was very excited that you responded, and I really appreciate your time and doing this offline recording and sharing such wise words and really encouraging people and inspiring people. Maybe besides losing your mind and coming to your senses, is anything else you want to share before we say goodbye?
The word love comes
Whoa.
to mind. Can we learn to love ourselves and each other and everybody get along better?
Wow. Amen, amen, amen. Amen, amen, amen.
TMS, war is TMS.
Yeah, exactly.
It's all unresolved,
Yeah,
unconscious stuff that we can't allow ourselves to feel and be with,
yeah,
so we project it out.
yeah.
So
Wow,
that's what comes to mind when you
beautiful.
ask me that.
So I'm grateful for your time.
Well,
Thank you.
thank you too.
And I never like to say goodbye because that's my trauma. I like to just say we'll meet each other again. Thank you so much. And have a wonderful, enjoy your Sunday on the East Coast.
Okay, you
Nice
too.
day. And I thank you again, Dr. Bob
Okay, you
Evans.
take care. Bye-bye.
Okay, now wait. Don't go away.
Oh, I'm still here?